Millions of people each year suffer from eating disorders. Anorexia nervosa is a common type of eating disorder. Many people can relate to it either through a friend, family member, or through a more personal experience. Like all eating disorders, anorexia is more than a physical illness. It is also a serious mental disorder. For this reason, it is characterized by not only having a low body weight, but the person also has a fear of gaining weight, even if they're already underweight, and the person has this distorted body image, where they may deny the fact that they are underweight or believe that their body weight has a correlation to their self-worth. One cause could be genetics. If a person has a family history of eating disorders, this puts them at a greater risk of getting one. There are also psychological factors. If a person suffers from depression, anxiety, or OCD, they are also at a greater risk. External factors such as the media, peer pressure, stress, and even sports can play a role. This Victoria's Secret ad shows how the media defines what the ideal body type a woman should strive for. A person, especially a young female, can develop unhealthy eating habits trying to get this body type, which can lead to anorexia. In this picture, you can see how the media manipulates images to fit their idea of the ideal body type. Faith Hill's arm and back have clearly been photoshopped and airbrushed to appear thinner. There are also many physical signs you can tell in a person if they're suffering from anorexia. The most obvious ones would be thin appearance, and the person might have thinning hair, or dry skin and a jaundiced appearance. The person may also be suffering from fatigue, dizziness, dehydration, constipation. This patient might also have irregular heartbeats, a low blood pressure, and females an absence of period. They may also be complaining about being cold all the time due to the fact that they have such a low body fat. There are also red flags in a person's behaviors and emotions. They may be obsessed with food, meaning they count their calories and talk about which foods they can and cannot eat a lot. They may skip meals, or they may spit out their food after chewing. A person suffering from anorexia might also have extreme dieting and exercise habits. They may also be taking diet pills, laxatives, or vomiting after each meal. A person may deny the fact that they are hungry, or make up other excuses for not eating. One could be that they are just tired, or they just simply forgot to eat. They will also downplay the role of them not eating. Depressed mood, lack of emotion, or irritability can also be seen in a patient suffering from anxiety. They may also be socially withdrawn. They may also wear baggy clothes in order to avoid confrontation about their weight. There are serious complications if anorexia goes untreated. Heart failure and irregular heart rhythms can arise. Bone loss, which can lead to frequent fractures or breaks. A person's electrolytes will also be unbalanced. The nutrients you obtain from your food help the daily functions of your body. Examples are potassium, chloride, calcium, and sodium. This is what your body needs to function because it cannot make these things on its own, and without them, serious complications arise which ultimately lead to death. Immediate medical care will be done to rebalance electrolytes, address any heart issues, and in extreme cases, a feeding tube will be placed in the patient. However, since it is more than just a physical illness, the patient cannot simply gain the weight back and be cured. They must learn healthy eating patterns, and they must change the distorted thoughts they have on their body image. In order to do this, patients will go through therapy, both individual and family therapy, with a psychologist, and discuss healthy nutrition with a dietitian. It is important that they learn that they are not just skinny, that they do in fact have a mental disorder. If you think that someone is suffering from anorexia, you can help them. Do not just tell them to go eat or to go eat a cheeseburger. This will probably offend them, and remember, they have a fear of gaining weight. The best thing you can do is encourage them to seek help from a medical professional and let them know that you support them. Thank you.